Hello, it's so wonderful to have you all with us here today. Thank you so much for joining us and welcome to Beyond Imaging, Advanced Workflows in Tricefy with Dr. Steve Rath. I'm Adrena Austin, your Trice Academy manager, and I will be your host for today's presentation. At Trice Imaging, our mission is clear: to provide quality of care for all people, regardless of who or where they are. And we carry out our mission with our innovative cloud solution, Tricefy, a centralized patient sharing, collaboration, archiving, and documentation platform for medical professionals. Now, before we get started and I introduce you to Dr. Steve Rath, there are a few housekeeping items that I'd like to share with you. As we have so many participants today and we are so excited to hear what Dr. Rath is about to share with us, I would encourage all of you to stay on mute for the duration of the presentation. Also, we will be hosting a quick question and answer session at the end, so I would invite you to please type your questions into the question field of the GoToWebinar toolbox, so that way we'll have a chance to have an open discussion after Dr. Rath's presentation and to have all of your questions answered. But right now, I am so thrilled to introduce you to our luminary and Tricefy user, Dr. Steve Rath. Dr. Rath is a double board certified obstetrician gynecologist with subspecialties in maternal fetal medicine and perinatology. He is consistently selected by his peers as one of the best MFM specialists in Los Angeles Magazine Top Doctor, and as a Southern California Rising Star for several years in a row. Now, when Dr. Rath isn't busy scanning Hollywood's elite, he is very active in the international medical societies, in research, and serving as a medical advisor. And we couldn't be more thrilled to have him here with us today to talk to you about how he leverages Tricefy technology to innovate and elevate his clinical workflows and grow his renowned practice. And with that, Dr. Rath, I'll turn it over to you.
Good morning, Adrena. Thank you very much. It's an honor and pleasure to be here today with everyone. And I know some of our guests are still starting to join, as we can see the attendee numbers go up. I wish we could all interact, and Adrena and I will be interacting during the presentation today, and I wish I could meet everyone on webcam, but unfortunately we don't have that capability. So I wanted to say good morning. I'm in Los Angeles, so it's very early in the morning here, and I wanted to wish a good morning or afternoon or evening to all of our attendees all over the world. I'm going to switch over here to the slides, and we can get started here. Okay, so as Adrena, thank you for that beautiful introduction. I am a double board certified specialist in obstetrics and gynecology and maternal and fetal medicine. I am currently in Los Angeles, as I mentioned, and I did all my training here in Los Angeles. I did my medical school at the David Geffen School of Medicine at UCLA. And then I went on to do my internship, residency, chief residency, and subspecialty fellowship training at Cedars-Sinai Medical Center. I was on faculty at the UCSF Medical Center initially after I completed training, but then came back to my roots in Los Angeles at Cedars-Sinai, where I founded my own private practice, which is now known as the Los Angeles Fetal Maternal Care Center. And we have 3 main locations in the Los Angeles area. We also have various outreach offices. I have affiliations with 6 major hospitals, though my office and main hospital is housed at Cedars-Sinai Medical Center. My practice is focused on advanced fetal ultrasound and diagnosis, and the management of high-risk pregnancies. I practice both. I still practice obstetrics, so I'm still doing deliveries, and I also practice uh, maternal fetal medicine as a consultant. So with that, we can go on to the next slide.
So, Dr. Rad, I would love to hear. You've just told us about your 3 different main offices. You are affiliated with 6 different hospitals and clinical sites. What were some of the pain points or the challenges in the clinical and image and data management that you faced as you were extending your services to all of these different sites?
Yeah, so before founding my own practice, um, I worked for I worked for the hospital system, and then I worked for some various private practices before developing my practice. And when I was working at the different sites, there was so much difficulty in just management of the imaging, reporting, documentation, sharing, collaborating with other providers and with the patient. There was a lot of infrastructure problems. You get to use like multiple various reporting systems or EMRs in order to just do your daily workflow. A lot of ultrasound softwares were outdated. There were issues with storing the images and having to work with IT, and having like large servers in your office that had to be secured and protected, and you had to know about compliance. Then there was issues with like how long you can archive the images for. One of the most difficult thing was just daily workflow. You had to have multiple um, licenses to have different for each user you have to have a different number of licenses, which could get very expensive. So we only had a limited number of uh, users that can log in at the same time due to those limitations. Um, each site was using a different system, or they wouldn't talk with each other, and you couldn't access your imaging or reports unless you were at that specific office. You had to use paper to write notes and sticky notes, and um, you had to, in terms of like patient sharing, you had to use either print images on the black and white printers. You had to use DVD. Sometimes some sites use DVD, or just USB burning, which took forever, and there was limitations on that. In terms of sharing reports, people, some of the sites I worked at were so archaic, you would sell them to mail the reports, and faxing issues. And it was, remote access was a big issue because you really had to come like early in the morning or stay late to finish your reports because there was no way to access the system outside, or you had to come up with like all these novel ways and buy all these softwares where you can securely log in from home. Um, and then again, on with those softwares too, these like third-party sources where you remotely log in, there was limitations and how many people can be remotely logged in on the same computer at the same time. I would be at home and I'll be fighting to like remotely log in to finish our reports for the day, or if I was at the hospital and I wanted to access the reports, or I was at another site and I wanted to access the images or reports from another site because like I was getting a hospital consult, all of a sudden I had to wait, or I had to call and wait in line for it to be my turn to use the system. Um,
Right. So
so
all of the pain points that you're managing, that you're talking about, really are an impedance to being able to care for your patients, not only care for them, but do it in a timely manner. So how was it that I can imagine, and I'm sure so many of you on the line with us today can relate to some of these headaches that Dr. Rad is sharing with us, not being able to get into a PACS or not having access to data, having to use sticky notes and so on for annotations and noting. So there must have been a point where you were like, that's it. I cannot continue to work like this or grow my practice in this way. So when was it that you found the Tricefy solution, and how did that help to address the many pain points that you were enduring for so long?
Yeah, I think that, yeah, and the breaking point also was this issue. It became like a patient safety issue where I couldn't access the images or reports anywhere, anytime, and it also took a lot of time and energy, and so uh, I was getting kind of fed up, and um, I learned about Tricefy initially because there was a little buzz. This is years ago. It was one of the first users, and there's a little bit of buzz about few practices in the country that they can do patient sharing and texting of images. And as I started to develop my own practice and think about how I wanted to do things differently from all these different, where I was working, looking at all these different problems, I was trying to find solutions for my own practice as I started to think about making my own. And I heard just about the patient sharing was the most exciting thing. Patients were getting texted images. Um, it was like a big secret. I finally figured out that it was Tricefy and Trice and their software, just Tricefy. And I contacted them, and I was so shocked to find out how easy it was to just set up and become part of Tricefy, and that it was a lot more than just patient sharing. It was allowed you to archive your images, and in any case, so it was really an image archiving system, and was solved a lot of these problems that we discussed. And the patient sharing part was a bonus in terms of like growing my practice and making the patients happy. And we'll talk about that in a little bit. But that's kind of how I, first heard about Trice and Tricefy. And so I started my practice, and if it wasn't the way I was able to start, my own practice, it was because of Tricefy and all the great things you can do with it. And so I just had to, it was like the only thing I had to sign up for was Tricefy, and I can use it for multiple things and eliminate all the kind of problems that we talked about. So it allowed me to have remote access anytime, anywhere. So Tricefy, all your images are archived on on the Tricefy pack system, so to speak, which saves your images and studies for 10 years and even beyond if you like. I didn't have to worry as I'm opening my new practice about getting licenses for every user and every staff member. And if I ever wanted to add other providers, I didn't have to worry about that, or how many computers I could use it on. Or if I wanted to be at home, I didn't need to remotely buy some other software where I had to remotely uh, access the computers in my office and leave them on all night and be worried about all that. Um, it interfaces, um, it allows, then I realized that it allows you to um, upload documents. So you can upload lab. So in addition to the pack system, and I'll show you examples later, but besides just the imaging, you can use it as an archive for documents related to that patient. So their labs, their non-stress tests, all their intake forms, their consent forms. I even, there's a reporting system, and I also adapted that to use it for prescriptions, billing, saving records, results, telephone calls, telemedicine. And so I saved a lot of time, just even starting my practice and growing it, and eliminated a lot of concerns. I even use it for non-ultrasound visits like telemedicine, which we'll talk about. So there's a lot of ways you can use Trice and eliminate all these, problems that we discussed in terms of infrastructure, workflow, and remote access. And now my entire practice is completely based on Tricefy. Everything we do in our office is on Tricefy from A to Z. Probably just the only thing that's not on there is the scheduling system, but otherwise, and probably one day Trice will resolve that issue. But otherwise, everything, everything for my practice is on Tricefy now.
That's fantastic. It's so great to hear that, Dr. Rad. And I heard that you mentioned that you've uploaded all of your documents, your lab, your non-stress test, intake forms, billing and records, and that you actually use our adaptive reporting solution to assist you with that. Can you tell us a little bit about some of the novel ways in which you use our adaptive reporting, which is our documentation solution where you can create custom reports? Because you use this in a way, Dr. Rad, that I've not really experienced anyone else using, and it's helped your practice tremendously in terms of being able to move all that daily work into Tricefy.
Yeah, so when Tricefy first came out, adaptive reporting wasn't an option, but as again, I was one of the first users. They started to talk about reporting, and they have developed an amazing platform here for reporting as well. So again, Tricefy is not just an image archive or not just for patient sharing. But you're able to develop, and here's some demo images here. In any language, you're able to develop custom, unique template reports that are applicable to your practice. And then you can, and not only, so here's, in this image here, they have an example of a second, we put an example of a second trimester ultrasound report. You have the patient demographics and the procedure you did and fetal evaluation and biometry, anatomy, both fetal and maternal. Here's an example of a report in Spanish. So you can create these unique templates for reporting, but then I realized that if you can create these unique templates for just reporting, you can also use it to make templates for chart notes, telephone notes, telemedicine notes, for billing, for prescriptions. And then I noticed that there was a button that allowed you to upload documents. So then I'm like, wait, I can upload all of our intake forms. So the patients fill out their intake forms and we can scan it in and attach it onto the study. And then I can save the intake forms and all their consent forms for the next 10 years, in addition to their images, and in addition to all the reports. And then we even do text messaging with patients where they communicate sometimes with us with text and like, I broke my water, what should I do? And or they'll ask sometimes medical questions, and I want to keep record of all of that all in one place. So we'll take screenshots, and then we'll upload those screenshots into the patient's study. I will see sometimes patients post delivery, and they'll be coming for a postpartum check, and I'll put pictures of their C-section incision on there. So it's beyond just adaptive reporting. I realize I can use it for so many different things. Why don't we wanted to do a demo here. And by the way, you can log in anywhere, anytime to do your report. So again, you just need a web browser. You can even do it on an iPad too, or a laptop. From anywhere. You can be across the another country even, which I'll talk about if you're traveling and you want to log in and see what your office is running, and you wanted to do a report or something, if you're doing remote reading, or if your practice is just remote reading, you don't actually have to be there to do the reporting. So if we can, I'm just going to break out. I had wanted to show an example of adaptive reporting, not only reporting but also the little templates I made. So first of all, you can there's a template. This is Tricefy. This is what it looks like. It's just a website, tricefy4.com, and then you log into your user. This is Steve Rad, you can see your patients and your studies, any consults you did, which we'll talk about what that is, and then you have your templates. And all these templates I made, they initially, Trice gave me a set of like initial templates that I can use to customize on, and then I quickly learned how to use the reporting. Here, let's just open an example. So they gave me this template, but then I was able to customize it to the way I want. By the way, you can even pull images into it. And you quickly learn how to use it. And they have a lot of support, and soon there's going to be like a chat function here where you can chat with support. But the support is very quick. They actually have their cell phone number. I text them, and if I ever, I'm stuck, then I can text them and they'll answer me right away. I'll be like, I can't figure out my template, or I can't figure out how to fix this. Then right away they'll answer me. They'll either call or text me back. They're very, very accessible. Trice it's kind of like a family. So I made all these reports. So for first trimester antenatal testing, fetal echo, first, second, and third trimester. So this is how the templates look, how you develop them. So they gave, again, like I got from Trice, so then I was able to customize it to my practice with my information at the top here, and how I wanted the layout to be, what anatomy I can see in terms of the biometry or measurements, whether you do fetal or other types of ultrasound. It pulls in all that data. For example, all your fetal echo measurements or adult echo, if that's what you're doing, it pulls in all the measurements for you directly from your machine. And you can, pre-fill out however you want. You have make different drop-down menus here. I have a set impression and recommendations, which I edit for each, and then you can put images as well. So that's just for the reporting. And then I realized, well, I can also use it for other things. Why does it have to be just for reporting? I can use it for making like instructions for my patients for their diabetes 1 hour glucose tolerance test. So I don't have to each time tell them. And then by having this on that patient's chart, and I'll show you what it looks like, then I also save and I can document that I gave them these instructions. I can show them that I gave prescriptions. So I use it for, all my different lab orders. So like prenatal lab orders that I do on all my patients, I have a set template. I don't have to write all the orders every time. It's already like set here. If I need to change anything, I can quickly change it specific to that patient. So my office can help me, write prescriptions really quickly because I've set, for all the various different common prescriptions I do. If I need to write a letter for the patients, work note, or to their insurance company for authorizations, I can use Trice to write those those letters. Telemedicine, I do a lot of telemedicine visits, and I have a whole telemedicine template, all those telephone notes. And like patients call you or text you and you want to document it, so have a telephone note or just a general documentation note. And lastly, I also use it for billing. I don't know right now which category. Oh, active, yeah. So for billing, I have billing templates that I built out. And so as all the patient demographics you need in a typical billing. Then I have all the ICD-10 codes, and they're all drop down. I was able to, you entered all. It took a little bit of while in the beginning, and I'm happy to share. I put in the most common codes that we use. And then you can duplicate it, and then you have all the CPT codes here that are related to the various visits, and some of them can be pre-filled out. So I also use it for billing. Anyway, so what does it look like on the other side? So that's how you build out your templates. It's really easy. When you let's quickly create one. What it looks like on this end. Let's do.
So Dr. Rad, what you just showed us was
I
the
know.
template editor and how everyone can build their own custom templates. And what you're doing now is showing what it looks like to create an actual report and to have that become a piece of or a part of the examination.
Yeah, so this is just and I know we don't have too much time, but this is just exactly what you said, and this is on a specific study, demo patient, where a lot of it gets pulled in, and then I can start typing specific stuff for that patient, and the position of the baby, maternal structures, the biometry will automatically pull in. This is a demo, so it's not showing that. And then I can fill out the anatomy and give my recommendations. Again, I have all like kind of standard language there. And then what it looks like, you press finalize, and then it creates a PDF for you. So again, so it's just coming, all these various different documents that we showed come up after the images. So it's all in one study. So here I have the report I did. Here's the billing related to that patient. Here's the prescription I gave to the patient for gestational diabetes. And they're all here as, here is a note I wrote for the patient to be excused from work. And then you have the option for e-signatures as well. You can then download this and save it on your computer. You can print it and give it to the patient, or you can send it to the patient. Um, so they have a copy of it, whether you want to share your images or the PDF of like the work note, you can send it to them. Oops, sorry. You can send them directly from Trice, or you can download it and email it to them, however you want, or you can fax it to them. You can also technically send it to, it says send image to doctor, and that's for collaborating and consulting for second opinions, but you can send this report or work note to the referring provider as well, and they can receive that just directly. So you don't have to fax anymore. You can, or download an email. You can send the images, the reports, or images directly from Tricefy.
Dr. Rad, I really love the way that you have leveled up the adaptive reporting technology for all of these other uses. And now you've created or streamlined all of these clinical workflows that now allow you to focus on what matters most. And that's the time that you spend with your patients rather than doing all of this administration. So how do you use Tricefy in terms of your patient engagement?
Yeah, sure, so sure. We'll go back to the slides. But anyways, I just want to point out how beautiful the reports look. You can change it. You can put your logo at the top. There's various different colors. You can change all the, all of this can be customizable. And the Trice staff will help you, do that. But it's easy to learn after a while on yourself too.
Thank you for that.
So it's very exciting. And then and the reports look much more beautiful than some of the older reporting systems that are still out there. Okay, so for patient sharing, and sorry if I got so excited about the adaptive reporting, I took so much time into
We're
that. But
excited about it too, Dr. Rad.
so the in terms of patient satisfaction and how Tricefy even came about initially was, again, as an archiving system, but a patient sharing thing was kind of how people started finding out it years ago. So you can text or email patients their photos with a touch, with just with a touch of a button. You can either set up on your machine, and Tricefy is compatible with almost every kind of ultrasound machine, not just certain companies, but you can use it on the most common ones, GE, Philips, Samsung, etc. It's all compatible nowadays with almost every kind of machine. You can customize a certain button on the machine. So I personally use GE, but it doesn't matter. but there's different buttons on the machine, like P1, P2, P3. So you can quickly set up which button you want. You can send videos or you can send individual images directly to the patient from the machine, or you can log into the patient's study on Tricefy and click on the images you want and send it to the patient that way. But it's literally instantaneous during the study. You can send the images just by pressing the P button, or whatever button you assign on your machine. It instantaneously, within seconds, goes to the patient's phone or email. Most feel like, text messages are most common way of doing it. And it's very easy on the machine. On the study, you enter the patient's email or phone number, and it just takes seconds. So it helps patients bond with the pregnancy. They get the images on their phone. They're so excited the rest of the scan. Sometimes I see them just like staring at their phone and like they start texting the pictures while I'm still continuing the study. Sometimes their friends and family can't be there, so they already well, after a few seconds of starting your study, they're already sending the pictures to everyone, the link to everyone, a link that they get to everyone. You don't have to worry about burning DVDs and USB drives or printing thermal paper anymore. You can put your logo on the image. And so it's also allows you to do free marketing. And then people tell their friends and family that I got my pictures texted, but at this other office I went to, they didn't have that. And so it helps you also get new patients, because patients want to come to the practice that has like the latest technology. And it's not just about the fact that you can text the pictures, but it gives the impression that you have the latest technology in your office. This is an example of what it looks like. So the patient will receive a text or email, then they can click it, and it'll either take them to a website that's related to that link, or they can download a Tricefy patient app that creates a library. You can see here for example, in this phone, there was a study on the bottom and a study on the top, and it archives their images forever on their phone or their iPad, and they can save it to their camera roll from there. And so, and the images, once it's downloaded on your phone, it never expires. Or if they don't want to download the app, they can just look on the web browser itself directly. So it's kind of on the image on the left what it looks like on the patient's phone after they get the text or email and they click on it. So during the pandemic, this was very important because patients couldn't bring family members to the visit, depending on where you were in the world, depending on the local policies. Patients sometimes had to come alone. Their family members were outside, but we were able to instantaneously send images to the patient. The patient was able to forward it to their family, and everyone got to feel like they were there.
Dr. Rad, could you elaborate a little bit more on the Tricefy patient app and how you would use that for marketing opportunities or to connect with?
Yeah, absolutely. So so again, once you text the patient, let me just show you. These are your account settings. So my patients receive this when they get a text, they receive it. Dr. Steve Red has posted images. Please share with us on Instagram, and images delete in 90 days. That's if you don't use the app. But anyway, so they'll receive this message, and then there's an app which is shown in this image here in the previous page, that the patients can download. And you can, at the top, you can see here, it says like, for a complete view of your medical history, including reports, lab results, and prescriptions, be sure to log into my chart. So you can put right here on your account settings on your landing page, what message you want the patients to see, what links you want there to be there, and what message you want them to receive when they initially receive it. So it's really free marketing, and it's almost as if your practice, you can tell your patients that you technically have your own app through Tricefy, and it's very customized. Also, you can basically use it as your practice app because you can put updates there. You can put links to their chart. You can put links to your intake forms. You can put links. I mean, whatever you want, you can take advantage of this free app to build your practice. Not only and it's not only an image archiving from the patient side, but you can also use it for your own practice. You can put your logo on there. So now my patients, think I'm so amazing and I have my own app. But really I was lucky because Tricefy provides that, at no extra charge to our practice.
And we know how important it is to be able to have that patient engagement and to be able to make them, make family and friends feel a part of such a momentous time in a patient's life. But let's talk about and shift that focus to the clinical collaboration and how that lifeline, that communication to other providers is a crucial component on how you provide care and how you manage care for your patients, and how Tricefy is a part of that for you and allows you to do that.
Okay, absolutely. One cool thing I want to remember, because my last delivery, the patients, when they have this app, it's like every time the baby is delivered, they open their app and they start looking at the 3D pictures or the 2D pictures, and they're like, look, she looks just like her 3D pictures, and they always pull it out like at the time of delivery. So they really love their app, and it saves the pictures forever on their
I
on their
love that,
phone.
Dr. Rad. That's so cool.
So that's on the patient sharing side. I think you wanted to now talk about like clinical collaboration. So Tricefy allows you, and I'll have to go a little bit faster so we can show how that's done. But Tricefy allows you to collaborate with your colleagues and also with your patients, um, especially in the case where there's any like abnormalities or you need a second opinion, or you need to share a case with a colleague because you're going to refer the patient somewhere. So um, the most common things are when there's like brain or cardiac abnormalities for maternal fetal medicine, such as they want to speak with their neurologist or their pediatric cardiologist, and you're able to directly from Tricefy, from anywhere you are, send images and collaborate with your colleagues. And in terms of even if your patients, it also helps with clinical collaboration for your patients. Even so, I had an example here. The patient who I saw when she was in Los Angeles, but then she was moving to Singapore, and there was a filamentous cord insert and some concern for fetal growth restriction, and she moved thousands of miles away to Singapore. I was able to provide her, just through an easy link, uh, all the image studies, the images of her studies, which she shared with her provider in Singapore, and then the provider in Singapore was able to see my concern regarding the umbilical cord and the fetal growth, and the patient was placed in antenatal testing and monitoring there for the fetal growth restriction. And then at some point they were concerned about the baby's growth, um, not continuing to grow as well, and whether early delivery was required. So then we engaged in telemedicine, and because everything in my practice is on Tricefy, they were able to send me images back from Singapore, which I then uploaded into, you can add attached files. Okay, you can attach, one thing we didn't talk about, so it's not just adaptive reporting, but you can attach documents and files from outside into the patient's chart. And again, it comes up right after the images. So other lab results, pathology reports, outside records. So like someone will bring like 200 pages of their records from their fertility doctor, and I just scan all those into their Trice uh, study, and it's all there for the next 10 years. It's all linked to that study date. And so anyway, so it was, sent me images from Singapore. I uploaded that into her Trice, and and then we did telemedicine. Truth be told, I did the telemedicine while I was driving home. It was really late at night because of the time difference. So it was like the middle of the night, and I sat in my car in front of my house, and I collaborated with her doctor and with the patient, using the images at my office, helped me upload from the Singapore images. So, and their copy of their non-stress test, I had all that at my fingertips in front of my house in my car. And she was thousands of miles away, and I was able to go through, you know, all the different measurements with her, and the Dopplers, and the concern for the growth and when they should deliver. And I spoke with their the whole family was on the phone, and then we spoke with the provider. And they wanted to make sure I agree with the management, since they're in a different country and management's different. And her provide by looking at their images and their reports and everything that was all on my phone, I mean, I totally trusted her provider. They were doing exactly everything correct. And long story short, she successfully delivered this very beautiful baby. They sent me a picture of the placenta, that matched, the picture. But on a daily basis, or weekly basis, I'll share images with my pediatric cardiologist for fetal heart abnormalities, and they can write back to me on Trice, and it's all then documented, their their opinion. So it's very, very good for sharing images with other providers, no matter where you are in the world, or locally in your own institution, or in your own community. And the people you shared the images with, they don't have to have Tricefy. Okay, so let's cut to the showing how that's done really quickly. Adrina, I'm gonna send you um, uh, images of this patient. So I'm gonna send to doctor. It should come up in my yeah, there you are. Adrena and Trice imaging. So subject, I need help with this fetus's uh, uh, heart. Please let me know if you can see her today. So I
Great
can begin
Sorry, go ahead, Dr. Head.
so I can begin the consult with you, and then there's this little like it should be
I've received the consult already, Dr. Rad, and I'm going to
this
go
little
ahead and write you a response.
there's a little bubble here where you could you don't even have to have a Tricefy. I mean, like, you get a link and you don't have to have Tricefy in order to communicate back with me.
Great. So I was able to respond to you, and I'm sure if you just refresh the screen there, the note will be there. But it's a really powerful tool about how you can use this on a regular and daily basis. So I can see my note there. Yes, please
Yeah,
send
so
it
it's
to my
like,
office.
yeah, please send it to my office. Thank you. And I can write back, thank you. She'll see you today afternoon. I will send you the records. And I got an email. I was just looking at my phone. I got an email that you had viewed the images and you commented, so I know to go look.
Fantastic.
So I routinely use this, as needed with my colleagues, either other maternal fetal medicine specialists or pediatric subspecialists, or if the patient's transferring care, moving, whatnot, I can, collaborate with them. It's secure. The images can be anonymized if you like, and it doesn't require any extra softwares or permissions, and it can be done anytime, anywhere.
And I think it's the archiving really is at the core of all this functionality. And I know it gives you, in terms of scalability and worry-free archiving. I mean, it really is at the core of being able to let you take advantage of these features. And I think we'll talk about this just for a quick moment, because I think everyone's really excited to hear about how you use Tricefy to grow your business, and beyond.
Sure.
So we'll just take a moment here, and then
So really quick, the archiving, really refers to the images that are stored there for up to 10 years or more, if you need to extend it. But it in order to just to when you it's so easy to start up with Tricefy. Literally, to start a new practice on Tricefy can take anywhere from like 20 to 30 minutes. You have, they give you this, what's something called an uplink. You quickly connect your machines to Tricefy. It's secure. When I was at all these different offices in the beginning, not my own, there was all these like servers, and they were so secure and locked up, and there was backups, and then they have to take the backups home and switch them out every day in case anything got like burned or stolen. But with this, everything's cloud based. It's all compliant with various uh, regulations in your state or your country, and Tricefy is international. um, and everything's in one location. You can access it anytime. There's auto upgrading. You don't have any downtime in terms of your practice if they're upgrading the software. It all does it automatically. Everything gets updated automatically, and it's encrypted. It works with various different machines. All the most common ultrasound machines, and also with a lot of various EMR systems. Tricefy keeps adding partners that it works with the most common EMRs or other ultrasound reporting systems. Um, uh, Already. So I wanted to, sorry, really quickly before we go on. I guess I'll leave it at that. I wanted to show a little example about archiving that, but basically, and you can also save clips. Um, and again, it's safe and secure and easy to manage, and I don't have to worry about any security issues or servers and whatnot. It's all stored in the cloud. Um, so in terms of, I don't know if you had anything to say, Adrina, but in terms of, you wanted to hear about how it helped me grow my practice.
Yes, I think we're all dying to hear.
Yeah, so obviously it was easy to implement. I didn't have to hire anyone and pay anyone for IT and find someone who even knows how to use computers, because the Trice support team and myself can figure that out within minutes. And it was so easy that when I started expanding my practice and going and scaling up or doing outreach offices, even sometimes home visits, I can easily set up a new machine anywhere in any clinic really, really fast. And some of the machines nowadays have like Trice built into them, so you just log into your account on Trice and doesn't require anything fancy besides logging in. Some of them you have to put in some like different server informations and links, but that just takes 20, 30 minutes to do. So it's scalable because you can expand it to multiple machines, multiple sites, very, very quickly. And all your various practices, they can be organized when you log in. You can organize the images by what practice and location you're seeing them, by the referring provider, um, uh, and we so it makes it very easy in terms of all those problems with setting up softwares and reporting and security and all that stuff, as we've already discussed. And it really helped me grow because I could scale my business. I didn't have to worry about any of that stuff, and I could just start seeing patients, right away. I saved so much time. I saved so much money. I didn't have to buy all these like third party logging in from home and all these extra software. They saved thousands of dollars just on that. I didn't have to pay anyone for IT. So it really helped me save time, money, worry, and energy on focusing on my patients and growing the practice itself. Obviously, with the patient sharing, it increased the patient satisfaction, and I was known as a practice that you can get your pictures texted, and it's so exciting, and you get share it on social. They also like have all these buttons where the patient can easily share the images from their app or from the website onto their social media, and it was free marketing for me. And then allowed me to collaborate. I didn't have to figure out how am I going to send images to the cardiologist and show them. I mean, within minutes, I can send my entire study to the pediatric cardiologist. she can call me back 5 minutes later after she's reviewed the images and say, yeah, I think this is like a tetralogy. I agree with you. You know, send her to me. I'll see her tomorrow morning or whatnot. Um, so it allowed me to have that support from my colleagues and be able to collaborate with them. It because you can do remote reading and set up remote offices and telemedicine and improved patient access and to care and make healthcare more equitable. There's multiple users with no license. I mean, like I can have all my sonographers have logins and my staff have logins, and I don't have to pay for each of them to have a login. You just go into your account and make them a username and login and password. We talked about the free marketing with all the images have your logo on it, and then you have your own practice app, so to speak, because you can customize it to your app. And by having everything in one place, anywhere, anytime, and I've been doing the adaptive reporting, putting in all the labs and records. Like I could be in labor and delivery, and I need to get all their prenatal labs or their fetal echo results. It's all on their Trice study. So I've been able to save time and energy, not having to like log into multiple systems to get all their records. And then it's all at my fingertips. I don't even have to use a computer. I can just use it on my iPhone. So honestly, the one of the biggest ways I was able to open my own practice, a secret, one of the biggest secrets was Tricefy, because it eliminated all the problems and then expanded, made it so easy for me to scale up, collaborate with people, make my patients happy, have access anywhere, anytime. I can travel, have access to see what's going on in my office, or I can be at another office and remotely read if I need to. If I have to send a run to a delivery in the middle of a scan, then I can tell my sonographer, like, Brittany, finish the study. When I get to the hospital, I'm gonna log in on my phone and I can see what the measurements are in the last 5 images that I missed, that I have to run away for, and then I can call you and like I can let you know that it's okay to send her home, and then I can talk to the patient and tell her. So it allowed me to have this capability to so much like versatility, so many things you can use it for. We already talked about billing. Oh, and then like if you use a billing company, they can come in and log into your Trice and look at your billing for that patient because it's all under that study. They can see the study and what images you had. So I made like a username for the billing team. And oh, by the way, everything, there's like an audit trail of, oops, there's an audit trail um, uh, on Tricefy. You can see who's logged in and what they've done on the study, what they edited, so you can see who in your staff are billing, whatever. And also, I wanted to show this. There's a lot of like product updates. You can see also like they automatically upload messages here with this little bell. Like, oh, here's our webinar. It shows that it's coming up. And they talk about, they have made a little announcement of patient app branding. That's how I found out about that. So it's all streamlined all in one place. And I'm sure that there's more things coming, but they don't tell like everything. Like the latest phone, you don't know what's coming next, but there's so many things coming all the time. Tricefy is growing and coming out with new features. Um, and also, I can send the reports directly from Trice to my referring providers. I don't have to worry about downloading and faxing and printing and mailing it and all that stuff, or DVD burning, whatever. I think I get the point.
And I love hearing that, Dr. Rad, and how it supports your practice. But where do we go from here? How has Tricefy kind of been there for you during the
Yeah.
pandemic and kind of beyond your vision for the future?
So before I run out of time, yeah, so the industry is changing. It's becoming more, medicine's changing. It's becoming more virtual. And when the pandemic came along, because I had all these other things already set up, I was quickly able to adapt to, telehealth and telemedicine because I use Trice. So even if the patient hasn't had an ultrasound done, you can create a study for them and do all your chart note documentation on Trice using adaptive reporting and writing like a note. So patient doesn't even have to have an ultrasound, by the way. So if you're just doing telemedicine with a patient, you can create a study, create reports, do all your documentation. No image, it has nothing to do with, it doesn't have to do with ultrasound even, believe it or not. So I use it as basically my EMR, in other words. So during the pandemic, it really came through in terms of telemedicine. It was already there. I didn't have to like go find another way to do telemedicine. I just adapted my Trice to it within seconds. I didn't even have to ask him. I came up with the idea myself. And then we were trying to minimize visitors coming in. So it allowed us to do do a little bit more remote reading, allowed providers to improve access to care anywhere, anytime. And really the future of medicine has to do with telehealth, remote reading, artificial intelligence and machine learning, um, and patient engagement. And nowadays patients are a lot more tech savvy and demanding, and Tricefy is already the future. So it already has all these things built into it. And I I always know in the background that there's more things coming that you're not telling us. You probably know, Adrina, like what they are. I don't even know what, but there's, I know like artificial intelligence is the wave of the future, and Tricefy has a huge team in engineering, and they're always ahead, um, of the game, and they always have things up their sleeves, and it's always improving. And the most beautiful thing is all in one simple website.
Well, thank you.
There's
Thank
no
you,
actual even like software to install on any computer. It's all on a cloud-based system, and it's amazing.
Dr. Rad. Thank you so much for your time and sharing your expertise and how you use Tricefy technology to improve your clinical workflows and to expand your practice. And I know, because I can see the list of questions growing as you speak, Dr. Rad, I want to make sure that we have time to open it up to the floor. I've got a few questions coming in. The first one is about kind of in terms of your business practice. We know we talked about how it can save you time, Tricefy can save you time and reduce your costs, reduce your worry. Can you give us some examples of how much time you think that Tricefy might save you, or in terms of cost, how much cost it saves you? And I understand that I'm throwing this at you last minute, so you may not have your spreadsheets out there ready for you, but if you can just speak a little bit to how that does help you to save time and money.
I mean, so again, because of the scalability and in terms of like growing your practice, you can, without any concern, add a machine to your current practice or open another site and get that site going within minutes. You don't need to worry about buying all these various different reporting systems and archiving systems and servers and security and how you literally just sign into your account, set up the new machine with what's called an uplink, or some of them now you can just directly log into Tricefy without doing any of that stuff even. And within minutes, the machine is on Trice, sending images to um, uh, the archive. So it's amazing for scalability. I've saved thousands of dollars because I don't need to hire any IT people. I mean, you can't even quantify it. It's like kind of priceless. There's like thousands of dollars I saved on IT, on security, compliance. I don't even know any of the rules because like Trice takes care of all that stuff, and I already know that they've done their due diligence and everything's already up to standard. Um, so I save a lot of time, energy, concern, worry. I don't have to worry about any of that stuff, and I can just focus on my patients and making money, and I don't need to worry about any of it really. I mean, it's very seamless. So I've saved thousands of dollars, thousands of hours. And again, I don't have to worry about all the licenses and all that stuff. So I can log in remotely anywhere, anytime. So it's really priceless.
Excellent. And we have a question coming in from Jenna. She would like to know, is this the only EMR system that you use in your practice? And Jenna is currently using Viewpoint. Do you also have Viewpoint? And that's from Jenna.
Okay, so I had tried, and I told you, Adrina, because I adapted Trice and made up all these things on my own to my practice because it was so easy. And I'm like, okay, I'm doing something wrong. No one else is doing this. Maybe I'm like, am I doing something wrong? Am I crazy? So I spent, okay, everyone's gonna think I'm crazy, but after like I have this system working, I signed up for all these different, I signed up for different ultrasound reporting systems. I signed up for different EMRs. I'm like, oh, everyone has an EMR but me, and like I need to get an EMR. And they were so, and I had to like, you had to put you have to do like a sign up fee, and then I had to get like, you had to come out for training, and I had to pay for these people to come out for training. I mean, this is after I've had Tricefy using it for years. I thought I was like missing out on something, and I wasted so much money. I never used any of this. I've tried multiple different reporting systems and also EMRs because just everyone else maternal fetal medicine was doing them, and not, I'm like, maybe I'm being crazy. I need to check this out. Am I missing something? And anyways, I wasted so much money and I got into so many fights with these different companies, and I never ended up using their software. I lost a lot of money. So yes, I'm only using literally one EMR. Everything is on Trice. I have no other EMR, no other reporting system, no other there is like some e-prescription services which you can sign up for, which I haven't yet because I just do all my prescriptions on Trice. And for billing, I use like an outside billing company, but they'll come into my Trice and look at my billing. Anyways, for me, for my practice directly, everything is on Trice. And I did, after using Trice for many years, explore these other options and wasted thousands of dollars, and I'm embarrassed to say that. Um, Viewpoint, maybe you can say more, Adrina, is actually like one of the original partners with Trice, and they have Trice built into their software, and they have a lot of communication with one another. You can, by the way, it's not just Viewpoint, but there's many other ultrasound reporting systems, and you can, if you choose to continue to use your reporting system because you like it and you don't want to use the Trice reporting system, but you want to use Trice for archiving, you can set it up so that the reports you do on that reporting software go into the patient's Trice archive, just like my reports do from Trice, but like from Viewpoint or Sun Ultra or whatnot, can go directly to um, the Trice archive for that patient. So you can, if you've paid for the systems and you'd like to continue using them and you have licenses, you can still use them and adapt it and connect it to Trice. And Trice
Yeah,
is
that's
very good about partnering with all these various different EMR systems and the most common ultrasound reporting systems for every specialty.
That's great, Dr. Rad, and you're absolutely right. If you are currently using Viewpoint, there is a Tricefy add-on that just requires the Viewpoint license, one of your additional licenses, and lets you take advantage of the flexibility and the remote access of the cloud, which we do have several, many customers that do actually do that. We have another question, then I'll open it up to the floor if anyone just wants to unmute themselves after this and speak directly with Dr. Rad. But this is more of like a clinical workflow question. And the question says, I'm already using Tricefy for my organization. I'm interested in learning how others set up workflows for automation, especially concerning sharing PDF reports with patients and integration into other tools like eCliniWorks. So Dr. Rad, are you currently sharing, because I know you upload all your documents into Tricefy, are you also using any of the automation tools to send PDFs directly or anything like that?
Yeah, so like, let's say you want to send this report here to the patient or to the doctor. There's a little green, I hope everyone can still see my screen, but there's a little green little check mark here. So first of all, I go to clear selection, so nothing else is clicked, and then I click on the little green check mark of the report, and then you can send it either to the patient or to the doctor, and you can bypass faxing or emailing directly from Trice, so it saves time. If you don't want to do that, if you want to download it on your computer, you can also download it and then email it or fax it from like an e-fax. And then there's also like a send to EMR button. So you can also send the report to your EMR, and then if the patient has like access to the EMR system where they can see their reports, they can also they have like a portal, they can also see the report there.
That's fantastic. Now I'll just give it a moment in case anyone wants to unmute and ask Dr. Rad. If anyone wants to ask Dr. Rad a question directly, just go ahead and press your microphone icon at the top to unmute yourself, and I'll give you all a second to do that. Okay, I can still see that we have a few of you there. Let me check my pane there. So what do you think? We've got a question coming in. What are the kind of key drivers for you in healthcare in terms of the patient view or like from a practitioner view? Ooh, I don't know. Oh, can someone please unmute Dr. Rad? I don't know how that happened. Jen, if you're there, can you unmute Dr. Rad?
Okay, there, I'm back. Thank you.
Yay, thank you.
Okay, sorry. Do you want to do the question again really quick?
It was the key drivers in the healthcare industry. What do you think is driving this shift of healthcare in the moment? What's important from a patient perspective? What's important from a clinical perspective? If you have 2 or 3 things.
I mean, everything after the pandemic, everything's kind of gone virtual and everyone's kind of become tech savvy. And so I think the future of medicine is, virtualization, telemedicine, artificial intelligence, machine learning, and this patient engagement. And so I think if I'm understanding your question correctly, I think that's what the key future drivers are, this new having the latest technology. And Tricefy has been for years ahead of the game and has had all this stuff, and it's been seamless. Tricefy didn't even have to adapt to the times. It already had all this stuff ready to go without Tricefy even knowing that there was going to be a pandemic, and now everything's becoming more virtual. And so it's amazing. Tricefy is already the future, and I know that they're secretly already ahead of doing research and developing things and engineering things that they'll release sometime in the near future, but they won't tell me what it is.
Yeah, that's right. So we have a few people that are wanting to ask questions, but they cannot unmute. I see you, and I understand that it's very frustrating, and I apologize. I don't have a control to do that for you, I don't think. Let me take a quick look. But what I will say, Brian, is if you go ahead and you type your question into the toolbox right where you said I cannot unmute, then we'll be able to field it from there and get your question answered, because we definitely want to hear from you. Oh, okay, here we go. Thank you. Is there a way to graph fetal growth in serial reports? That is a great question, Brian. I think, why don't I field that one?
Yeah, I think you can answer that.
Yeah. So basically, we do offer all the measurements that come over to our adaptive reporting are from the machine. So the sonographer, the operator will input the patient data and the measurements into the machine, and then they will come over into the appropriate fields into the customized report. So the question is, do we have fetal growth? There are ways to import the growth charts. So now what we ask people to do is to take a picture of the growth chart, and then that will become a part of the record. That is one way to do it. We do have percentiles, but in terms of graphing fetal growth and serial reports, you will be happy to know that that is something that is on our roadmap just now and that we will be working on shortly. So I hope very soon to be able to give you the answer that yes, we can do that, but I want you to know that we take a lot of pride in the feedback and listening to what our customers need from us. And having serial reports for fetal growth is one of those heavily requested items that we are currently working on. So for the workaround now, what I would say to get the graphs in there is to take the photo of it on the machine, and then it'll come over and be a part of your patient record, and then you can even drag and drop that into the report. But for the fetal growth in serial reports, I will just say watch this space, watch your notifications and communications, and that is on the roadmap to come out. Thank you for your question, Ryan.
Yeah, Adrian, that was one of the limitations of the adaptive reporting, and I'm so excited that you're saying that they're fixing that. That's the point. They're constantly updating and auto-updating different features, and it's amazing they're going to have that coming up in the near future. What I do is, like you said, look at my sample report where I pulled, there's pictures here of the fetus, but I will just I'll take a screenshot on my machine of the graph, and then I'll pull those graphs in here and as an image, and for the time being, that's my workaround, like exactly what you said.
That is fantastic. Heather asks how long Tricefy archives images. I think I'll take this as well, because Heather, I'm so glad you asked that question, because we have different term durations depending on what the needs are. Sometimes the compliance or the legality changes from region to region, and of course we're available globally, so it depends on where you are a customer, how long you have to archive. So we have packages now from 10 to 25 years, but that is something that is customizable. And again, because of the scalability of the cloud, we can offer anything from like a 1-year term with our patient sharing to 5 years, 10 years, and upwards. So my best advice would be, and I will give you an email. It's hello@triceimaging.com. And if you have questions there, to please, and Catherine, you're asking about our adaptive reporting. What I invite you to do is to email us at hello, and you can see that presentation on that slide right there, hello@triceimaging.com, and we'll be able to gather any questions that we haven't been able to have time for today, because I see this is so exciting, but we've come 15 minutes over, and I know there are still more questions coming in. So what I would ask everyone to do is to just email us at hello@triceimaging.com for any general queries or queries about Tricefy services that you'd like to incorporate into your practice, and we'll be able to assist you there and make sure that we qualify you for what you need for your practice, whether that's the term of your archive, storaging, or what. But because the cloud is scalable, we can offer a lot of flexible options for you. And with that, I will close out the Q&A session, because I know, Dr. Rad, you are very busy and need to get back to your patients, but I want to thank you.
Just say,
yes,
can
please.
I say one quick thing about that to the
Always.
Tricefy is very affordable, and you can even, there's some practices in terms of the patient sharing that will monetize sharing the images. So there's also a potential for that. As I just quickly thought about that, but I do want to reassure everyone that, at least for me, you'll be surprised how affordable it is as compared to other systems.
Thank you so much, Dr. Rad, for adding that, and thank you for sharing your time and your expertise with us. I know I've been really excited about all the novel ways in which you use Tricefy technology to level up your practice and make your life easier as a healthcare provider. We all know our healthcare providers are under stress on a good day, and now even more so as we shift into these pandemic times. So I want to thank you so much today for your time and expertise, and to please connect with us on social media, connect with Dr. Rad on social media. You can see it, everyone that he's scanning. Yes, Dr. Rad.
And yeah, no, I just wanted to thank you for the privilege and honor to speak. I have no what do they call, like, disclosures. I'm not paid by Trice, and the reason I guess you invited me is because I love Trice so much, and runs my entire practice. And so I come here, to talk about Trice just out of the pure love I have for Trice. I have no, I'm not getting paid for this,
Yeah.
and I have no interest, like I have no shares in the company or anything, and I really just speak from my heart. And I
Thank
want
you,
to
Dr. Rad.
thank you for having me, and thank Trice for everything they've done for me and always being available to me.
Thank you so much. And I think I speak for all of us. We can feel that passion that you have for your patients, for Tricefy coming through. And with that, I invite you all to reach out to us, hello@triceimaging.com. And once again, thank you, Dr. Rad, for your time. And thank you all for spending your time and being with us here today. And we look forward to hearing from you again soon. So with that, thank you very much. And we will catch everyone next time. Thank you so much.
Thank you. Bye bye.
Bye now.